We are in the midst of flu season, unfortunately, but we thought we would bring in one of our good friends to give us some advice on how you can get through it or avoid it. I'm pleased to welcome to our studios Dr. Kira Weaver, who is with the Emergency Medical Department at Lehigh Valley Hospital in Hazleton. And first and foremost, you're a homegrown girl. You're local, you're from this area, so I guess congratulations on the position you have and the fact that you are working in your hometown area.
No, it's a pleasure. I've enjoyed being back. So it is a privilege to serve your hometown. So it's nice to be back after being away for so long.
I'm sure many people who see you are probably more comfortable too with a person that they know when they see you. I mean, under extreme circumstances, but still it's nice to know we have a local person in the ER for us.
No, I'm sure it is nice because of the fact that you're used to the area and the other physicians that are in the area, so it gives that familiarity. So I think, for putting myself in my patient's shoes, that's probably, beneficial.
Well, hopefully your patients are not coming to you with the flu, but unfortunately, we know it is out there. So how difficult of a season has it been thus far in the Hazleton area as far as the flu?
We've been seeing actually quite a bit of flu this year. Patients I think are more aware of the flu than in the past, and so they come in, looking to see, what they can be doing for symptomatic treatment if they benefit from Tamiflu. So I think they are more aware, so that might be why we're seeing some more of it. But I also think too, in general, it's probably a little bit more stressful of a year for flu in general.
Are we seeing more than one strain?
So we commonly have been seeing influenza A or B. So we are seeing a mix of that. It seemed like earlier in the flu season I was seeing more just influenza A, now we're seeing influenza B, and I can't really tell if we're seeing one more than the other, but we are seeing quite a bit of both.
Now, for someone who is watching, maybe they're not feeling so well or they know someone who's not feeling so well, how do we know the difference? How do we know if we have a severe cold or we have the flu?
So flu, you tend to be a little bit sicker overall with the flu. So there is some overlap in symptoms, like, you can have congestion, you can have cough. And when I say congestion, we're talking about not just chest congestion, but congestion, like nasal congestion. You may have a sore throat. Nausea, vomiting, and diarrhea tends to be more so, in the presence of these upper respiratory symptoms, more associated with the flu, although it can happen with cold. Fever is probably something else more defining. Like if you notice that with fever, you can get fever with cold also, but fever is more notorious with the flu. Tends to, when patients have flu, it seems to be longer duration of symptoms than a cold. You can have the flu, basically flu symptoms for up to 2 weeks. Some colds, you tend to be sick for a few days and it kind of clears up. So, there is overlap, making it difficult. If you're not sure, come visit us or one of our express cares.
Very good advice. So now, if we do have the flu, when are we contagious?
So you're contagious several days before you even start showing symptoms, which makes it difficult to kind of, keep yourself away from other people that may be at risk of developing the flu. One of the things that you can do at the beginning of flu seasons that's helpful is getting a flu shot, because that decreases your chances of developing the flu, although you still can get the flu if you get a flu shot. However, you do not get the flu from a flu shot. So it is helpful for that. You are actually still contagious, like if you're still having fever, so we usually tell patients that they need to be fever-free for about 24 hours before returning to work or school.
I would think because we're contagious when we don't know it, that contributes to the spread of the flu.
Right, so during flu season, hand washing is important, maybe not shaking everybody's hands, covering your mouth when you cough, some basic measures, just kind of being more cautious about that we're kind of in that flu season. Does limit some of the spread.
Who are the most susceptible to getting the flu?
In general, the very young and the very old. So the very young, like we're talking about infants, because they have not been, completely immunized, or they are getting immunized. The other thing is that, younger children, they're getting exposed to viruses and bacteria for the first time in their lives. So until they kind of mount that immunity, that memory of these pathogens, they tend to be a little bit more susceptible to developing flu. The very old, because unfortunately everyone as they age, their immune systems do get a little bit weaker than when you're younger, so they tend to be more, susceptible to flu. Then there's special populations, so patients with, like multiple serious medical conditions, such as like pre-existing respiratory disease, like COPD. Patients that also, like for example, are like immunocompromised, like patients with cancer or weakened immune systems, they can be more susceptible to developing flu. And pregnant patients have to be cautious too, although, like to be evaluated and treated for flu, because flu can affect not just the mother, but the baby. So it is important, if a pregnant patient is concerned that they have the flu or flu-like symptoms, to get evaluated sooner than later.
And I know there is Tamiflu out there that is supposed to, I guess, decrease the length of the flu. When is that beneficial? When would we have to get that, and who do we get it from?
Okay, so Tamiflu is most beneficial if it started within 48 hours. So if you're having symptoms for 5 days and you come in, it's probably not going to shorten your duration of the flu, because you're probably kind of, you're already like infected and you've been having it, and it's kind of, at this point, it's going to kind of just resolve on its own over time. But Tamiflu does shorten the duration of the flu by a few days. So the earlier you start it, the better response, because once you take it, it gets into your bloodstream, and so it's a little bit more active at that point. But it does need to be started early on. Where to get it? So you can go to your primary care provider. You can get evaluated and be seen at our Express Care or at the emergency department. So it's just it is a prescription. Sometimes we can start it in the emergency department, but it is a prescription that you can get over basically at any of the pharmacies if prescribed.
Is there anything else we can do? You mentioned hand washing and not shaking hands. Do vitamins help, or is there anything else we could take that maybe helps to build us up?
Vitamins, they can be helpful. Like they talk about things like zinc and vitamin C. It's a discussion, like if you're going to start vitamins, to talk with your primary care physician, especially if you have other medical conditions. But I think like eating healthy in general and trying to take care of yourself, making sure you still stay well hydrated and getting sleep, all these things can contribute to your body's immunity to fighting the flu.
Great advice. Thank you so very much for all of that information. We hope that our viewers are not going to get the flu, or maybe they've had it already and they're over it, but we hope that flu season will subside soon. If in fact you do find yourself not feeling well, take the advice of Dr. Weaver, and hopefully we can all stay healthy this winter.